Is your body trying to tell you something is wrong?
It's not that we should start screening earlier, we should start listening to our bodies.
Doctors say it is a problem too many people are trying to ignore.
Studies find cases of colon and rectal cancer are on the rise in young and middle-aged adults, and many of those cases are being diagnosed late when the disease is much harder to treat and cure.
Our Dr. Frank McGeorge here with a closer look at why. Doc?
Experts think the risk of these cancers is rising in young adults, partly because of unhealthy diets, obesity, and lack of exercise. But something else is preventing that critical early diagnosis. Oftentimes, patients are having symptoms, but they're not getting them checked out.
Come here, Naya.
Stephanie King knew at some point she would have to have a colonoscopy. Doctors recommend the colon cancer screening for African Americans starting at age 45.
I was nervous about going to get a colonoscopy done.
Even though she was nervous, Stephanie didn't hesitate to get the test at the first sign that something wasn't right.
I started having stomach pains, and one day I stayed in bed all day with, really bad stomach pains, and I couldn't eat anything, and then I started throwing up.
A colonoscopy revealed a large tumor that, if not removed right away, would have led to a difficult cancer battle.
It would have spread to her lymph nodes and possibly to other organs, and she was literally just one stage away from needing chemotherapy.
Dr. Christopher Dwyer says, unlike Stephanie, many patients wait too long after the first sign of symptoms. He says that's part of the reason why colon cancer rates among people between the ages of 25 and 50 are on the rise.
It's not that we should start screening earlier, we should start listening to our bodies and getting the word out to primary care physicians as well as to the patients themselves.
Any change in bowel habits is a red flag. That can include diarrhea, constipation, narrow stools, or other changes. Often overlooked symptoms include cramps, abdominal pain, and unexplained weight loss. Patients can experience rectal bleeding, blood in their stools, frequent gas pains, or bloating. Internal bleeding can also cause anemia, fatigue, or shortness of breath. Stephanie is grateful that she listened to her body. After surgery, she's cancer-free.
I'm so thankful and happy that I did go ahead and get the procedure done. And then, of course, I have my beautiful grandbaby, Anaya. She's 8 months old. Hey, baby. And we love her to death, and I'm just happy that I'll be here to help my son and his wife continue to take care of her. I'm so happy and thankful.
In the earliest stages, colon cancer often causes no symptoms, so that's what makes getting screened so important. Now, during a colonoscopy, doctors can even prevent cancer by removing precancerous polyps. Now, if you don't have a family history, 45 is the recommended age for African Americans and 50 for everyone else. If you do have a family history, you need to start sooner, and your doctor can help determine when. Now, there are other ways to screen, so don't let a fear of a colonoscopy keep you from seeking help if you have symptoms. The sooner a problem is found, the easier it generally is to treat. Back to you.